Good afternoon, everyone. I'm Sarah Rosen Wartell, and I have the great honor of being the president of the Urban Institute and of welcoming you all here today. Before I jump in, I need to do a few notes of housekeeping. Today's event is being recorded. The recording and relevant links will be posted online after the event, and we have turned live captions on. If you find that you would prefer them off, just click on the live transcript button at the bottom of your screen. All of our audience today are muted, but if you, we really welcome and encourage you to join the conversation. So please type questions into the Q&A box at any time, and we'll be bringing those into the conversation later on. We'll also be sharing a link to a post-event survey, and we would really appreciate it if you'd share your feedback with us. It both helps our panelists to hear what you're thinking about, and it helps us shape what we're going to do in the future. Finally, join the conversation on Twitter or other social media using the hashtag #LiveAtUrban so others can be part of the conversation with you. So with the logistics behind us, let me turn to our topic today. For older people, people with disabilities, and families who lose a spouse or parent, Social Security has developed into an essential, indispensable part of their economic security. In 2023, the Social Security Administration will administer benefits and payments for over 70 million people, and Social Security will cover about 181 million workers and their families. Social Security is as integral a part of our social safety net as anything else we have. However, the program is expected to run short of the funds needed to pay 100% of benefits in roughly a decade, according to the latest annual actuarial report from its trustees. As more people qualify for Social Security in the coming years, the Social Security Administration faces increased challenges to adequately serve new and its current beneficiaries. So to help us get a better understanding of these challenges and the opportunities for change facing the Social Security Administration, we have a pleasure to talk to my former colleague, the now acting commissioner of the Social Security Administration, Dr. Kilolo Kijakazi. Prior to Kilolo's appointment as acting commissioner, she served as the deputy commissioner for retirement and disability policy at SSA from the beginning of the Biden administration until July of 2021. For 7 years before that, she was an Institute Fellow at the Urban Institute, where she developed collaborative partnerships to expand and strengthen our rigorous research agenda. She helped us to effectively communicate findings from all kinds of different research to diverse audiences, and was indispensable in our efforts to recruit and retain a diverse research staff at all levels. She also conducted research in areas of economic security, structural racism, and the racial wealth gap. Before joining Urban, she was a program officer at the Ford Foundation, where she focused also on building economic security and incorporating the expertise of people of color in all aspects of her work. She has a social work degree from Howard, a public policy degree from GWU, and she is a real thought leader on economic security and communities of color. So it's a real honor to welcome home Kilolo Kijakazi. Welcome, Commissioner.
Thank you. Thank you so much, Sarah. Thank you for your really gracious and kind your words and your welcome. And it is a pleasure for me to return to Urban and discuss the opportunities and challenges facing the Social Security Administration.
So let me ask, let's just jump right in here because we're going to kind of go through a lot of material in a short period of time, I hope. Social Security, as I was saying, is so indispensable, so many different people. It's so much a part of how they think about their present or their future. It's really almost an sort of indispensable part of American culture. It has broad bipartisan support, so much so that we sometimes even take it a bit for granted. This is obviously the area where you have spent most of your career, but you're in a different seat now. So I was wondering if you could just start us off by sort of from the seat you're in today, the perspective you have, talk about your perspective on the importance of Social Security, not only to retirees, but also to people with disabilities and their families.
So let's start with the numbers. This year, SSA provided insurance coverage to over 181 million workers and their families, and we will pay over $1.3 trillion in retirement, survivors, and disability benefits to over 70 million beneficiaries, which is an increase of about 8 million beneficiaries since 2013, just a decade ago. Over 63 million people receive old age survivors and disability insurance, or OASDI, the full name for Social Security. 5 million people receive Supplemental Security Income, or SSI, a program for low-income individuals who are aged, blind, or disabled. And an additional 2.5 million people receive both Social Security and SSI payments. For example, many seniors who have limited income and resources turn to SSI to help ends meet. And very low wage earners who need to claim benefits before full retirement age may be left in poverty. Early retirement means the retiree will receive an actuarially reduced retirement benefit. Social Security was never intended to be the sole source of retirement income. However, very low wage earners often do not have sufficient earnings to save enough for retirement, and often do not have jobs that offer employer-sponsored savings plans. And I believe the next panel will discuss this challenge further. The Social Security program provides a core source of financial security, not only for workers, but for their family members too, including millions of children. Census Bureau data show that over 1 million more children would be living below the poverty level in 2021 if their families had not received Social Security benefits. And in addition, over 1 million children with a qualifying disability received SSI as of 2023. Social Security is also a critical lifeline for people with disabilities who are facing some of life's hardest moments in life. In FY 2022, SSA paid over $200 billion in disability benefits to over 14 million people. Given the importance of our programs to the well-being of individuals and families, when the pandemic hit and our field offices needed to close to walk-in traffic, SSA quickly transitioned. Field office managers continued going into offices day after day and saw by appointment customers with a dire need. Our systems office equipped employees to work from home and to continue to assist customers by phone and online. Online transactions increased from 50% of all transactions before the pandemic to about 60% now. In April 2022, we successfully resumed full in-person service in our 1,200 field offices and 300 hearings offices. We used predictive analytics to identify offices that had the potential for experiencing high demand, and we enlisted volunteers from across the agency, as well as SSA retirees, to assist with offices in serving our customers. Along with managers, the volunteers triaged service needs of customers waiting for entrance to our field offices. They identified customers who were disabled, elderly, or otherwise unable to wait online and escorted them inside. They informed customers who had other places to wait, such as their vehicles, that they would be alerted when it was their turn. And they showed customers how they could go online to receive services if they did not want to wait. As a result of our employees' tremendous efforts, we had lines at less than 5% of our offices. We continue to increase our online service capabilities to provide user-friendly digital self-service options. This allows millions more people to complete their business online quickly and securely. This also provides our employees in our field offices with more time to assist customers who do not have online access and may have more complex needs. The Social Security program enjoys broad public support, and the agency does too. The Partnership for Public Service recently commissioned a national survey about trust in the federal government. Their survey showed that SSA is one of the most trusted agencies, second only to the National Park Service. I have no doubt that our employees are the reason. And I am very proud to work with such incredibly dedicated people.
So Kilolo, I should say, Dr. Kijakazi, it is very clear that you face daunting scale and challenges of people that you are trying to serve, and that huge efforts are being made to support customers with the best possible customer service. But we do know those challenges remain. People who've applied for Social Security disability benefits often have to wait months, some even years, for their applications to be ultimately approved or denied. You have high levels of staff turnover, and you've had difficulty maintaining the service levels. You've described some of the backlogs and long wait times. Those continue to persist to different degrees. So what is your sense of the prospect for turning around these challenges? How quickly can we expect, with the scale of the institution you lead, that customers can sort of sustain and feel confident that their needs will be met?
So first, let me say a word about what has contributed to the challenges that we're facing. For over a decade, SSA received insufficient funding from Congress to administer its programs. This resulted in hiring freezes. At the same time, the number of Social Security beneficiaries was rising. I want to show one slide that was created by SSA's Office of Budget, because in this case, a picture truly is worth 1,000 words. Some staff who felt overworked began leaving. In addition, SSA has experienced the effects of the Great Resignation that occurred in the larger economy. As a result of the series of events, the FY 2022 SSA experienced its lowest level of employees in 25 years. In addition to staff shortages at SSA, we are also confronting historically high employee losses in the State Disability Determination Services, or DDSs. DDS employees are hired by states but funded by SSA. They make medical determinations for initial disability claims and reconsiderations and conduct continuing disability reviews. The pandemic, combined with high attrition, created backlogs. Initial disability claims pending have now reached over 1 million. Our top priority is to address the backlog of initial disability claims. People join SSA to serve the public, and we are determined to do this. To reduce the backlogs, we need to have enough staff at SSA and at state DDSs to handle these claims. To hire the level of staff needed, we must have sufficient funding. This fiscal year, SSA's operating budget is $14.1 billion. This is an increase of $785 million above FY 2022. We are really grateful for the additional funds, but it's important to understand that this increase is 55% of the requested increase in the President's FY 2023 budget request. Most of this covers increases in fixed costs. With much of the remaining funding, we are recruiting, hiring, and training thousands of new SSA and state DDS employees. We are replacing our losses during the year and adding about 4,000 SSA employees. I have assembled a disability tiger team to develop the implementation solutions. This work is well underway, and the team has employed analytics to identify bottlenecks in the disability determination process and the factors contributing to them. They've established a cadre of adjudicators and reviewers to assist with initial claims and reconsiderations for states, and with some of the states with some of the greatest backlogs. They've established a cadre of attorneys from the Office of Hearings Operations who are conducting disability hearings in the DDSs to free up experienced state disability examiners to work on initial claims. And we are forming a cadre of former SSA retirees who can provide assistance where needed at any point in the disability process. We are using artificial intelligence tools to assist in reviewing medical files that have become increasingly voluminous, and to facilitate more efficient collection of medical evidence. We are establishing a national contract with medical and psychological consultants, and we issued guidance permitting telehealth for certain consultative examinations. And my executive team and I are visiting the state DDSs and hearing firsthand about the issues they are facing and working with them on proposed solutions. Improving service will take time and sufficient resources. The funds we receive for FY 2023 will help us maintain our current level of service, but are not sufficient to make the improvements we had hoped to be able to make. We anticipate that some performance measures will show improvement in FY 2023, while others may show temporary degradation. For example, we are processing the oldest disability claims first. This will result in a longer average processing time until these older claims are completed, and then the average processing time will improve. We expect to begin to see improvements in fiscal year 2024 once our new hires are fully trained and the people who are training them resume their casework full time. We know that the backlogs make their way through the appellate process, so it's imperative that we stay on top of reducing the hearings backlog. In FY 2022, our hearings backlog reached its lowest level in 20 years. By FY 2024, we expect to eliminate the backlog and prevent its reoccurrence. We will need President Biden's full $15.5 billion budget request for FY 2024 if we are to improve service. This funding level would allow us to maintain the hires we are bringing on this fiscal year. If the FY 2024 budget proposal is approved, it provides about $264 million in increased IT funding to maintain and further modernize our IT systems and increase our suite of digital and automated services. Hiring, training, IT modernization, and finding more efficiencies in our business processes are all essential to improve service. To accomplish this, SSA needs to receive sufficient and sustained funding.
So a different aspect of customer service is the Social Security, the Supplemental Security Income Program, which you mentioned earlier in your remarks. In addition to retirement and disability benefits, this is a targeted program for older people and people with disabilities who have very limited incomes and few assets. As you know well, research suggests that many of the people who are eligible for SSI don't even apply because they either don't know about the program or because the application process, which I gather runs to 20 pages, is just so daunting and difficult, particularly for people in those often difficult circumstances. So what's the strategy? What are you trying to do to help make people more aware and make this process more sustainable for people?
The number of SSI applications has decreased every year since 2010. We have undertaken multiple initiatives to increase awareness about the program and to simplify the application process. During the past 2 years, we have cultivated a network of thousands of community-based groups who assist people with completing applications, or they provide us with referrals of people who may be eligible for SSI. We've created new positions for SSA staff to serve as liaisons to these community-based organizations, review applications coming from them, and follow up on referrals. We also surveyed the organizations submitting SSI applications to understand the barriers they encounter in taking claims. We use their feedback to design tools and strategies to expand outreach to additional community organizations. Direct mailing is another initiative that we have undertaken to ensure that potentially eligible people are aware of SSI program, the SSI program. We mailed notices to Social Security beneficiaries who may be eligible for SSI because their benefits fall below the maximum federal SSI amount. By the end of 2022, we sent out a total of 1.4 million notices. As of February 2023, these targeted mailings have resulted in over 96,000 SSI applications taken and nearly 47,000 applications approved. Based on our data through February, over $11 million in cumulative SSI benefits have been paid, with an average payment of $237 per month. That is money that these Social Security beneficiaries would not otherwise have received. We are also working to ensure that SSI is accessible to people. The SSI application is long and complex, in large part because of legislative requirements for the program. To overcome this, we have taken several steps. In March 2022, we implemented an online protective filing tool for SSI. The tool allows for individuals or their representatives to provide a minimal amount of information which preserves that date at the date of their filing for SSI. An SSA employee then follows up with the applicant for a full interview. We've received about 600,000 successful submissions since the tool was launched. SSA has also conducted 3 rounds of user testing with the public, and we are revising the questions for SSI eligibility. Our planned approach incorporates simplified, streamlined SSI eligibility questions in our online application based on public usability testing and testing with SSA technicians. And these are the employees who currently work with applicants to complete their applications. In addition, we are exploring options to reduce public burden by pre-filling certain answers on the online application where possible. We have a goal this fiscal year of increasing the total number of SSI applications by 15% in comparison to 2021.
So I often think of you as a teacher, and I know that personally for me, you've taught me a great deal about racial and gender inequities and inequalities across our society and what it really takes to sort of tackle the lasting legacy in the way that those forces are still embedded in so many different aspects of society. SSA, like every other agency in government, was charged by the president this year to think about the ways in which the operations of your own agency can create barriers to equity and how you might go about tackling some of those barriers. So can you talk a little bit about the SSA approach to equity and how this brings together some of your prior learning and the plans the agency has today?
Absolutely. In line with the administration's whole of government agenda to advance equity, part of SSA's Equity Action Plan is to focus on removing barriers for everyone, and especially for the aged, children, people with mental illness, people experiencing housing instability, individuals with low income, those with limited English proficiency, people of color, and women. As part of this plan, we are improving the collection and publication of race and ethnicity data. This will expand our ability to evaluate how applicants and beneficiaries are faring under current and proposed policies. In addition, SSA has revised the enumeration policy. We have discontinued requirements for the public to provide evidence to change their sex designation of male or female. We have also taken steps to inform our employees of the criticality of treating the people we serve equitably. Everyone in the agency is required to receive training in implicit bias to enhance their awareness of how they treat others, including the people we serve. Our Office of Hearings Operations conducted additional training with judges to increase their self-awareness and to minimize any bias towards claimants. SSA also fully complied with the Elijah Cummings Act by making our Office of Civil Rights and Equal Opportunity an independent office that reports directly to the commissioner, and by making it its leader a deputy commissioner within the agency. This office also leads the agency's diversity and inclusion efforts and processes civil rights complaints from the public relating to access to our programs. Not only is Social Security important to people of color and women, SSI is also a key program. In addition to the goal I previously mentioned of increasing the total number of SSI applicants by 15%, we have a goal of increasing applications from underserved communities by 25%. Underserved communities are those that have experienced a 30% decline or more in SSI applications. A majority people of color and or living below 150% of the federal poverty threshold. This year, we initiated a campaign that targets zip codes in underserved communities with the sharpest decline in SSI applications. This includes about 1,200 zip codes with a total population of nearly 17 million. The campaign includes placing signs about the SSI program in appropriate languages in neighborhood store windows and posters on bus shelters and inside buses. It also includes placing inserts in store checkout bags, airing new radio and TV public service announcements, and placing messages on social media. And we have also begun mailing notices about SSI to residents in these zip codes. The campaign seeks to increase public awareness of SSI by reaching people who are online, people not digitally connected, and those who care for children with disabilities who may be eligible for SSI.
All right, so I want to try to get one, maybe two last questions in. We've just heard about the enormous set of challenges that you and the leadership team at the agency face on customer service, on staffing, on reducing backlogs. At the same time, the president's budget proposed a new policy, a national paid family and medical leave program that would be administered by the Social Security Administration. What would it look like if you had that enormous additional responsibility as well? And how can you prepare for the possibility that that policy might over time win support in Congress and make sure that the agency can actually convince people it has the capacity to administer that program?
Yes, the President's FY 2024 budget proposes a national comprehensive paid family and medical leave program administered by SSA. The program would provide workers with progressive partial wage replacement so they can take up to 12 weeks off for family and medical reasons, and it would include robust administrative funding. The budget proposal requests $325 billion in benefit payments and administrative expenses for over the next 10-year period. That would be from 2024 to FY 2033. The budget assumes SSA would administer this new program and it would cost $2 billion in FY 2024 to establish the program. The proposed $2 billion for establishing paid family and medical leave is separate from the $15.5 billion in administrative funding for SSA in FY 2024. So beyond receiving the dedicated funding for establishing the national paid leave program separate from the budget that's already proposed for SSA, we can best prepare to administer this new program by remaining focused on reducing our disability backlogs.
So one of the questions we have from the audience is about the reality that you do have a trust fund. The trust fund is not as robust as some might like it to be for the future, but it has significant resources. And yet you have just made a argument that Congress is not giving you sufficient funds to administer the program and be able to meet the needs of the current customer base. I think to many, it may not be clear the way the congressional budget process works, that even with that trust fund in hand, there are limitations about what it can be used for and where you need to go for resources to run your program. Can you share just a little bit more about your freedom or lack thereof to use the resources that are provided in the program and what it is that Congress has to specify?
So unlike the benefits that we pay out, those are unlimited. You know, whatever the benefit demand is, that's what we pay out. There are no hoops that we have to jump through for that. But our administrative budget is limited, and we have to receive the budget that Congress will approve. So the appropriations committees have to determine how much we can spend. The president provides a budget request, as we indicated, $15.5 billion for FY 2024, but then Congress weighs in and says how much they are actually willing to provide to SSA. So we have been meeting with members of Congress to let them know the need and to indicate how our hiring of staff really has an impact on our ability to provide the kind of service that we want to provide to our customers.
So I want to just raise two questions quickly that are operational in nature. I think we have an audience that knows your agency well. The first question is about whether you have, and I'm going to ask you both and ask you to see if you can respond to both. Is there a plan to make the SSI application fully electronic, like the effort that you described around SSDI? And then the second question, and probably I'll have to do just a quick reference to this. There's a document called the Dictionary of Occupational Titles that you use in order to reference for eligibility for the disability insurance program. And by all accounts, it is very badly out of date. And I know you're in the midst of a process to update it, but I think the world is waiting. And so I was wondering if you could also describe the timetable for that process. So the dictionary, and then quickly the how we're going to embrace, how you're thinking about technology in the SSI application.
So just quickly, the SSI application, as I said, is complex because of the law. So we have to work on what changes we can make in the application and still honor what is required by law. So that work is underway. We have, the first step was to put forth the online, that piece that preserves the date for people who go in and fill out the information about eligibility. That preserves their date. That's a brief first step for the online application process. The rest of the simplified application process that we wish to put online, that is underway. I don't have a specific deadline for it, but it is one of our highest priorities. With regard to the dictionary of occupational titles, any change SSA makes to our policies must be well supported by evidence and designed to achieve decisional accuracy. And it is for this reason that we engage with the Bureau of Labor Statistics, or BLS, to develop and administer the Occupational Requirements Survey, which will be incorporated in the Occupational Information System, or OIS. This will be the new system. BLS continues to collect ORS data that we will be using. Once completed, OIS will replace the Dictionary of Occupational Titles and provide updated evidence-based occupational information that meets SSA's program needs. Our current decision-making process remains sound. Our existing regulatory and policy framework continues to ensure evidence-based disability decision-making. And under our program rules, disability adjudicators consider the opinions of trained vocational experts and disability claims and require an evaluation of ability to perform work. As we continue to work with BLS, we are also taking interim steps. We just updated guidance to our disability adjudicators and the vocational experts on determining if a job exists in sufficient numbers. We expect our adjudicators and vocational experts to look for common jobs and provide explanations to support jobs that they identify. And in assessing the evidence and developing the OIS, we are ensuring any changes are equitable.
Well, thank you, Commissioner. Thank you for taking the opportunity to be as transparent as you can about all of these challenges and the efforts underway in the agency to work on them. Thank you for coming home to your former institution and sharing these thoughts with us here, and really grateful for the chance to hear from you. We appreciate being with you. And now I'm going to turn it over to my colleague, Senior Fellow at the Urban Institute, Jack Smulligan, who will lead a panel to talk about these issues and others facing the agency. Thanks, everyone.
Thank you, Sarah. We have a distinguished panel of experts with deep expertise regarding all of the Social Security programs and the individuals they serve. After introductions, each panelist will speak for a few minutes, then we'll have time for questions. Manasi Deshpande is an assistant professor of economics at the University of Chicago and a research fellow at the National Bureau of Economic Research. She holds a PhD in economics from MIT. Manasi's research and interests include the optimal design of social safety net programs, their interaction with labor markets, and their effects on consumption, health, and well-being. Of particular relevance to today's discussion is her groundbreaking work on the Supplemental Security Income Program. Nicole Maestas is a professor of healthcare and economic policy at Harvard Medical School and a research associate with NBER, where she directs their Retirement and Disability Research Center. She received her PhD in economics from UC Berkeley. Nicole's research includes investigating work capacity and employment among older individuals and people with disabilities, and the working conditions in the American labor force. Nicole has published widely, and her innovative research on the SSDI program is especially relevant for today. Rich Johnson is a senior fellow at the Urban Institute, where he directs the program on retirement policy. He has a PhD in economics from the University of Pennsylvania. His research focuses on older Americans' retirement outlook, employment at older ages, and long-term services and supports for older adults with disabilities. Rich's recent studies have contributed greatly to our collective understanding of Social Security solvency options, job loss and occupational change at older ages, and the employment prospects for Blacks and Latinos over age 50. Alicia Monell is professor of management sciences at Boston College and serves as the director of the Center for Retirement Research. She has a PhD from Harvard. Alicia has contributed many important insights on tax policy, Social Security, and pensions, while wearing many different hats. She served in the Council of Economic Advisors and the Treasury Department during the Clinton administration, as well as at the Federal Reserve. She was co-founder and first president of the National Academy of Social Insurance. Now, I would now like to turn it over to Manasi to begin our discussion.
Hey, thank you so much, Jack. Thanks everyone for being here. It's great to be on the panel today. And it was great to hear the remarks from the commissioner. And a lot of what I'll talk about, a lot of the research that I'll talk about will touch on many of the points that the commissioner made. So I want to talk about the research on the benefits of Social Security disability programs. So I'll first talk about the benefits of the transfers themselves, and then I'll talk about the benefits of many of the services provided by the Social Security Administration to help people access those programs. So starting first with the benefits of the transfers themselves. So I have some research looking at the effects of what happens when we provide SSI benefits to young people with disabilities. In particular, young people who received SSI as children, they come up for reevaluation when they turn 18 and they have to requalify for SSI based on the adult program. And so in some of my research, I look at the effects of removing these young people from SSI at the age of 18 on their future labor market outcomes and criminal justice involvement in adulthood. And so what I'll talk about today is the effects of removing those young people from SSI on their long-term outcomes. Another way to interpret the research is as the benefits of providing SSI in young adulthood. Okay. So I took advantage of this natural experiment created by welfare reform, where some young people were removed from SSI when they turned 18, and then other young people who look very similar remained on SSI in young adulthood. And what's kind of novel about this research is that for the first time, we were able to link the Social Security records not only to employment records, but also to criminal justice records from a number of states through the Criminal Justice Administrative Record System through the Census Bureau. And what we see is that when these young adults are removed from supplemental security income at the age of 18, we do see some increases in formal employment. So we see some increases in the number of young people who are working in the formal labor market, as you would expect. But what was more surprising to us was that we saw, in addition to that, very large increases in the number of young people who are involved in the criminal justice system. And in fact, the increase in the share of young people who are involved in the criminal justice system is actually larger than the share of the increase in employment. And so being removed from SSI is actually having a larger effect on criminal justice involvement relative to employment in the formal labor market. And when we look at what that criminal justice involvement looks like when someone is removed from SSI, what we see is basically this is all driven by what we call income generating criminal activity. So we don't see big increases in violent crime. Instead, what we see is increases in criminal activity that is intended to generate income. So for men, this mostly looks like increases in things like theft, burglary, drug distribution. For women, this looks like increases in theft, fraud, so things like identity theft, and prostitution. Okay, and so we also can link these young people to their incarceration records in adulthood. And we see that this increase in criminal justice involvement and criminal charges then leads to an increase in incarceration. In fact, a pretty large increase in the likelihood of being incarcerated in adulthood as a result of being removed from SSI. And what's also interesting about this incarceration result is that it's touching on what the commissioner was saying about race and ethnicity, is that it's affecting disadvantaged groups more. So we see bigger increases in incarceration rates for children from single or no parent families who have lower parent earnings, and for Black youth relative to white youth. And these effects are also very persistent. So you might think that immediately, as soon as someone is removed from SSI at the age of 18, they might temporarily turn to illicit activity to recover some of that income. And then maybe they figure out how to work in the formal labor market. But that actually doesn't seem to be the case. Instead, these effects are very persistent. So even 20 years later, we see heightened involvement in the criminal justice system, more criminal charges, and higher likelihood of incarceration for the young people who were removed from SSI relative to those who weren't. And that effect looks like it's exacerbated by the Great Recession, that the Great Recession draws even more people into the criminal justice system than if there hadn't been a Great Recession. And when we put all of this together, what we see is that the government is saving money on not paying these SSI benefits, but it ends up spending the same amount of money on enforcement and incarceration. Of course, those are two different levels of governments that are paying for those two things. If we reverse all of these effects and we think about not the effects of removing young people from SSI, but the effects of providing SSI benefits to young people in SSI, what we would say is that SSI appears to be extremely effective at reducing criminal justice involvement, reducing incarceration, and reducing inequality. I have some related work that looks at also the effects of disability programs, both SSDI and DI, on financial outcomes. So we look at another natural experiment where there was a change in the likelihood of being allowed onto either the SSDI or the DI program. And we were able to merge in data on financial outcomes. So things like bankruptcies, evictions, foreclosures, and home sales. And we see that being allowed onto SSDI or SSI leads to large decreases in those adverse financial outcomes. So we see a reduction of about 20% in bankruptcies, a reduction of about 30% in foreclosures, and a reduction of about 15% in home sales after somebody is allowed onto either the SSDI or SSI programs. So both of these pieces of research speak to the benefits of the disability programs, the cash transfers in particular, and the health insurance access. The last thing that I want to touch on is the benefits of the services themselves, or rather the services that Social Security provides to be able to access the disability programs. So to do this, we looked at what happens when Social Security field offices close. I know we've talked a lot about closings in the context of the pandemic, but what we do in this research, which was written before the pandemic, is look at closings that happened in the 2 decades before the pandemic. And what we see is that when a Social Security field office closes, we see a pretty large drop in applications in neighboring areas, so about a 10% drop in applications, and an even larger drop in the number of new disability allowances in those neighborhoods. And as you might expect, these effects are larger for SSI applicants relative to DI applicants. That might be because the DI application is available online. It might be because DI applicants on average have higher education levels and might have more resources to be able to figure out the application. We also see larger effects for applicants with lower education levels and for applicants who don't speak English. When we look by age, we surprisingly actually find larger effects for younger people relative to older people. You might have thought that it was the opposite. And then when we look at type of disability, we don't see a lot of variation with respect to type of disability. But in general, we see these reductions in the number of applications and in disability allowances. And finally, we look at what's the channel through which these field offices are affecting people's likelihood of applying. I think our prior was that it was going to mostly be about travel time, that when an office closes, you have to travel farther to get to the next office, and that can just discourage some people from applying. What we find instead is more evidence for the effect of congestion, basically that when one office closes, the neighboring offices become more congested. There are more people trying to use services in those neighboring offices. Wait times in the offices themselves and on the phone go up as a result of a field office closing. And so it mostly seems to be about congestion, discouraging people from applying more than travel time. But again, right, if you reverse all of these results and you say, what is the effect of actually providing the services, right? This means that Social Security services that help people access these programs are extremely important, that there are a lot of people who would not apply for disability benefits in the absence of these services, that these services are playing a really critical role, even at a time when there's a lot of online information and assistance available. And so I would just leave you with that this is highlighting that those services are very important, especially for applicants who have lower education levels. So I'll stop there. Thank you.
Thank you, Manasi, and those are really striking findings and very appropriate to this conversation. And I will now turn it over to Nicole. And I think just need to unmute.
Can you hear me now? Yeah, Manasi, I think your work is part of an emerging body of research that is documenting the many ways in which vulnerable subpopulations face challenges accessing the disability programs. So, there are the examples of field office closures reducing an access point. Sometimes there's lack of internet access, which, it can't be used to compensate for the field office closure. And then, medical care barriers. If you can't get care, it's hard to build a medical record to demonstrate that you have a disability that's long lasting and potentially qualifying for the program. Still another example, my colleagues and I have studied the role of legal representatives. So these are folks like disability attorneys, although some are non-attorneys who are registered with SSA. But as the commissioner pointed out, this is a very complex process. Applying for disability benefits is a complex process. The application requires you to assemble your employment history, your medical history. You have to track down those medical records. If you've got the medical records, if you don't, you have to go get the care that will produce the record. And you might imagine that representatives could help people understand rules, complete forms, obtain medical records, help them develop stronger cases, help them see where their medical evidence matches regulatory criteria for disability benefits. And so, for a lot of reasons, we might think that legal representatives would help people. And indeed, we've seen them play a prominent role in the appellate stage. But recently, there was a surge in representation at the initial level, and this raised a lot of questions, and people had concerns about aggressive marketing practices by representatives. They were worried about incentives in the fee formula that they thought might encourage reps to intentionally slow cases down. More generally, the concern was, are they actually adding value here and helping people get benefits to which they are entitled to and qualify for, or are they simply extracting rents from the system? And kind of taking a step back, this is not, until now really hasn't been a standard feature of the social safety net that you would have attorney representation in the picture, but it is quite common in other civil law settings like immigration or housing, for example. So what we did is we developed a research design that would account for the selection into who has and does not have attorney representation for an initial disability application case. Overall, we found that in general, attorneys, when engaged in the case from the very beginning, from the initial application, that they improve case outcomes. So for example, they increase initial awards by 23 percentage points. Now, this is primarily driven by the awards for people who would meet the listings. So in other words, reps are able to help people identify when they do meet those listings, which are very complex and hard to, I think hard for me, in fact, to break down all the various ways that one might have a condition that meets or equals those listings. Reps led to fewer appeals, shorter overall time to decision because cases weren't needing to go to appeal. They were being awarded at the initial round. But interestingly, there wasn't an overall increase in allowances. So it wasn't that the reps were bringing new people into the system who, maybe were or were not, or would or would not have been allowed in. Otherwise, these were folks who they were going to get on, they were going to receive benefits eventually, but they, would have to wait for the multiple rounds of appeal. And so they were getting the benefits early in a matter of months instead of waiting for years. We also did not uncover much evidence of delay tactics. Now, we did find that, some very, very short decisions became a little bit longer, but the overwhelming effect was that long decisions became short decisions. And here, when we did detect some increases in waiting time, it was because not that reps were adding processing time, but that they were getting the claimant a more favorable onset date. So not adding time to the system, but getting an onset date that was a little bit more distant than it otherwise would be. So in overall, large benefits, small costs for applicants we found, and some substantial cost savings for SSA. But we also noted that it seems that this type of help, legal representation with a disability application, is likely underprovided in the market at this point because of the way reps are compensated. They are paid only if they win the case. It's a contingency fee arrangement, and that that is likely going to make inspire them to be quite selective about which cases they take. So they're likely to take only the cases where they think they have a good chance of winning. There was some interesting heterogeneity in these effects that I did want to highlight because they do dovetail with some points that the commissioner made, which is that people with mental health diagnoses benefit enormously, we found, from having initial representation on their case. That wasn't the case for people with back impairments, as just an example, but particularly important for people with mental health diagnoses. So I wanted to just wrap up with another kind of, a good news story about employment of people with disabilities. And one thing we've been really worrying about is that during recessions, people with disabilities tend to be very hard hit by employment losses. And then you tend to see increases in SSDI applications. But during the COVID recession, people with disabilities lost jobs about the same rate as people without disabilities. And remarkably, their employment recovery has been faster. As a result, the employment rate of people with disabilities is now higher than it was before the pandemic. These gains are concentrated in occupations that are teleworkable occupations. That is an occupation that could be done from home. And we think this might suggest that the sharp increase in this particular type of employer accommodation, telework, may have facilitated employment by people with disabilities. I think this trend is not just a COVID related trend. The employment of people with disabilities has been rising faster than that of people without disabilities for a number of years after the Great Recession and preceding the COVID pandemic. Really a truly historic turnaround in the employment rate that had only declined for decades. And if you look at SSA's own data, there has been a sustained increase in work exits from the SSDI program. That trend has been playing out over about 10 years. I was worried that when COVID began, it would collapse. There was a brief retrenchment, but the upward trend has resumed pace. So, I'll close just by saying I think this suggests that there is some progress being made in the labor market, and hopefully it's that there's a greater willingness by employers to hire people with disabilities and provide those work-related accommodations that actually do facilitate work.
Thanks very much, Nicole. Those are really interesting and encouraging findings. And I want to turn it over now to Rich.
Thank you, Jack. And I'm going to switch the conversation to the retired population. As the commissioner emphasized, Social Security is crucially important to older adults as well as to people with disabilities and their families. And yet, many older people continue to live in poverty. So in 2021, about 10% of people ages 65 or older had incomes that put them below the official poverty line. We had seen sharp declines in old age poverty from about the mid 60s to about the mid 90s as the coverage and generosity of Social Security grew. But there haven't been any meaningful, consistent declines in old age poverty since then. And the outlook for future generations of retirees isn't encouraging either. So my colleague Karen Smith and I have projected that about 4 in 10 people born in the 1980s will not have enough income in retirement to meet their needs or to maintain their pre-retirement living standards. And for people born in the early 40s and, the late 40s and the early 50s, so people who are now in their 70s, that share was only 3 in 10. For the millennials, it's 4 in 10. In addition, there are significant racial disparities in retirement security. So we project that among the millennials, 33% of non-Hispanic white retirees will have inadequate income compared with 42% of Black retirees and 53% of Hispanic retirees. And these projections assume that Social Security benefits that are currently scheduled will be paid in full, but the programs faces a long-term financing gap, and unless federal policymakers fix the program's finances, Social Security will only be able to pay about 80% of scheduled benefits after 2033. If that happens, then we project that 49%, nearly half of people born in the 1980s will lack sufficient retirement incomes, and that share is higher among Black retirees and among Hispanic retirees. So it's also found that there are significant racial disparities in Social Security benefits. So Karen Smith and I recently projected future Social Security benefits of people born between 1995 and 2006, so people who are now in their 20s, and we projected that median annual Social Security benefits at age 70 will be 9% less, about a 25% differential, 9% less for Black beneficiaries than for white beneficiaries, and that's in 2021 dollars. And then over a lifetime, we project that Black workers face a deficit of about $140,000 in median lifetime benefits. So these are really significant shortfalls. And the question is, what is driving these? And what we conclude is that Social Security reinforces many of the systemic disadvantages faced by people of color. So Black workers face systemic disadvantages in education, in the labor market, in health, in marriage, and mortality, and all of this reduces their benefits. And so we conducted a thought experiment by simulating what benefits for Black people would be if those disadvantages disappeared. And what our simulation showed, not surprisingly, is that eliminating all those disadvantages would nearly eliminate the Black-white gap in Social Security benefits. And the biggest impact comes from eliminating the disadvantages that Black workers face in the labor market. So eliminating disadvantages in other areas would have much smaller impacts. So at least in terms of equalizing retirement benefits, policymakers might want to focus on ways of leveling the playing field in the labor market. Now, this eliminating structural racism isn't going to happen overnight. So what can we do in the near term? One possibility is adding a meaningful minimum benefit to Social Security. Also bolstering supplemental security income can be very helpful, and you heard discussion of that earlier. I mean, I think one of the things to keep in mind that the commissioner didn't touch on is that this program really hasn't been modernized, so that the eligibility standards have not been kept up to date. The asset test, for example, was set back, or hasn't changed since 1989. The income disregards haven't changed since 1981. The benefit levels are generally pretty small. And so that is another way that could certainly reduce poverty at older ages. Some drawbacks to relying on Social Security: there's no dedicated funding stream, it requires a separate application, and today only about 60% of people eligible for SSI actually receive it. But it is certainly plays an important role, can play an even more important role in protecting vulnerable people as they reach old age. And I'll just leave it at that.
Thanks, Rich. That was a really concerning findings, and now I'll turn it over to Alicia.
Thank you, Jack. I want to use my remaining few minutes just to try to persuade everybody who cares about Social Security to brag more. I think, of course, it's important to acknowledge shortcomings in any program and seek to continuously make it better. But it's equally important to tell people how great Social Security is and how much it helps people in traditionally underserved communities. I might feel a little overwhelmed on the negative side because in preparing a grant proposal, I've been reading the Social Security material on the learning agenda, the equity action plan, and lots of other documents. This stuff makes it sound like Social Security is totally failing in the delivery of services and leaving behind about half of the American population. While existing barriers are real and economic outcomes are unequal, focusing so much on the problems creates the impression that Social Security is a program riddled with deficiencies that struggles to deliver basic services. And the media has bought into these characteristics. It emphasizes trust fund depletion, office closing, disability backlogs, and totally ignores the positive impact that Social Security has on people's everyday lives. People said this earlier this morning. I must say that the commissioner and Sarah Rosen did a good job of balancing, better job than in most forums. Social Security currently insures virtually the entire workforce against the loss of earnings due to death, disability, or retirement. It provides benefits to more than 70 million people, as been noted this morning. But the checks go out like clockwork and offer lifelong protection for retirees and a vital lifeline for those with disabilities. But there's studies that show that it also helps just the groups that we're concerned about. Its progressive benefit formula and its universal coverage makes it especially valuable to historically disadvantaged groups. Our research using the health and retirement study shows that Social Security is a tremendous equalizer in narrowing the racial wealth gap. Without Social Security, a typical white household has 5 to 7 times the wealth of a Black or Hispanic household. But you add in OASI, and that reduces the gap to 2 or 3 times. That's not acceptable, but Social Security makes a huge difference. And this analysis doesn't include DI, and once we, which we hope to do, add that in, it will make the picture even more clear. Social Security also provides COLA protection, which is underappreciated most of the time, but when you hit a period of rapidly rising prices like this, it's much appreciated. And full inflation protection outside of Social Security is just non-existent. The COLA also particularly helps Black and Hispanic beneficiaries who tend to rely on Social Security more than other households. They also tend to be renters more than homeowners, and so they get hit with rising rents where homeowners see costs raise over time and they can sort of plan their expenditures. The Social Security benefit calculation limits work history to 35 years rather than an entire work life. This design helps women who take time out for caretaking and vulnerable groups who experience extended unemployment, ill health, or incarceration. So those are just 3 examples of and some of the DI stuff that you guys were talking about, of things that Social Security demonstrably improves. And it's a wonderful program, and it helps precisely the people that we're worried about. It does face challenges that need to be addressed, but I just want us to spend as much time bragging about the program as we do worrying about its deficiencies. Thanks, Jack.
Yeah, thanks, Alicia. That's a really great one to finish our initial comments, and definitely appreciate that. And I realize that we only have a few minutes for questions. One that we've received from the audience is, it relates a little bit to some of the discussion that occurred in the first panel, and that is about why can't we simply simplify the SSI program, for instance, eliminating in-kind support and maintenance, and recognizing that Social Security actually has recently removed food as a part of in-kind support and maintenance, and certainly a number of us on this panel have proposed simplifications in SSI, and kind of welcome any kind of comments that anyone from the panel would like to make in terms of advancing those, and also kind of recognizing that that's ultimately an act of Congress.
Can I make I have a question. And so there's also an inadequate medical minimum benefit on the retirement side. And the question is, for people with very low levels of income, is it better to try to solve that problem through SSI improvements or through improving the minimum benefit? It'd be nice to fight one battle instead of two battles.
I think there's a lot of advantages to using SSI.
I do too.
It's useful to keep multiple options available to policymakers, but SSI allows for kind of greater targeting, and it also, enables you to reach people who are not getting Social Security but are relying on SSI. And so I think some of the minimum benefit proposals that have been advanced really end up benefiting a fairly small portion of Social Security beneficiaries, because they rely on people having had work histories many times of 30 years. And in many cases, the groups that you're targeting are for reasons of health and caregiving not able to work for that length of time. So the SSI can end up being kind of better targeted, but I welcome comments from others on the panel.
Yeah, I'm just going to reinforce what you said, Jack, that colleagues Karen Smith and Jean Sterling did find that a minimum benefit could almost eliminate poverty at older ages. However, they made that benefit available to everyone with only 10 years of covered employment. And that's not generally most of the proposals, as you said, required much longer service. When you do that, its reach is much less. This minimum benefit becomes much less effective. And I do think that having people with limited incomes, with limited employment, being covered, having their benefits of basically old age security taken care of by SSI, which is funded by general revenues, leaves more money for moderate Social Security beneficiaries.
Want to open it up to kind of comments from the panel on sort of the, kind of responding to the other comments that have been made from the panelists. I realize we're up against the 3:15 kind of time frame for this event, so want to be respectful of people's time. Yeah, if there's no other closing remarks, thank you for all the participants who have listened, and for our panel members, and everyone have a good afternoon.